Hi, I'm Dr. Carolyn Fields. I'm with Paris View Family Practice, which is part of Bon Secours Health System. I grew up in a family that included physicians and other medical people, so I was always exposed to medical conversation at dinner. The other side of my family was very focused on serving other people and doing things to help the community. And I found that going into medicine, and in particular going into primary care, allowed me to marry both the scientific interest and the ability to help other people. I think the doctor-patient relationship is critical. We work together as a team, and in knowing somebody over time, we know what to expect from each other and what somebody's goals are, and it allows us to tailor what we do to that situation. When patients come in for a first visit, we want to get to know that patient, and so we'll gather information and do whatever exam is appropriate for that day. We'll usually also send for old records from any other facilities that the patient has been getting care from, and we'll develop a plan for going forward and taking care of that patient's needs. I love it when patients come back and tell me that what we did has gotten them to feeling better, and they tell me thank you. If I wanted just to make money, there are easier ways to make money. For me, this is a calling, and it's a rare privilege to be able to share in people's lives. A good doctor is somebody who has the knowledge base to understand how to take care of patients, but also is compassionate toward those patients and has a servant's heart. I chose to go with St. Francis because I appreciate the values that St. Francis offers. I think patients are seen as important people, which mirrors my attitude toward patients. And I appreciate a system that focuses on providing good care. I do think that a faith-based system is very important because it affects how people are seen and the goals of care. I think it affects the attitude. I appreciate that St. Francis provides many community outreaches, and that caring for people in ways outside the traditional doctor-patient relationship is important to St. Francis. Outside of work, I enjoy a variety of things. I like cooking, which is nice because that's practical. I also like singing in my choir at church. Our whole family enjoys reading, and we like hiking in the mountains. The most important thing I would tell patients is that taking care of themselves involves making smart choices every day, eating well, exercising, stress management. And doing those things well helps reduce the risk of disease and the need for medication.